I'm so happy to be here today and share with you what I know about fostering resilience. I've been studying resilience for most of my graduate school career and now as a professor as well. So I'm fairly well versed. There's still a lot that I can learn. So I hope that this gives you some kind of a foothold, some kind of a foundation for where we can go in terms of how we can help our community to foster resilience. So today what I'd like to do is define resilience, define some factors of resilience, and then we're going to discuss tips for fostering resilience in individuals, families, and communities. So first, what is resilience? Well, resilience is the capacity to adapt well in difficult times. This is a dynamic ability, meaning it's changing, right? It's a capacity to adapt and overcome stressful circumstances without losing psychological well-being. In simpler terms, resilience is doing well or turning out well in spite of multiple negative things in your life. Every human being is resilient. All of us have the capacity for resilience, right? Repeated exposure to stressful experiences can actually enhance an individual's capacity for resilience. And I'm going to talk about how that happens. So resilience is defined not just by those negative things, right? But it's a balance of risk factors, protective factors, and positive outcomes. There are conditions that might contribute to this. It could be your attitude. It can be your spirituality or religion, right? It can be your education. But it could also be things that are more close to you, like your interpersonal relationships, the relationships you have with friends, family, colleagues, those types of things. This is a visual to help us sort of think about those risks and protective factors and what that means to resilience. What we want is for the protective factor side of our personal resilience to always be out of balance in that side, right? We always want to be having more protective factors going on than risk factors. And to be perfectly clear, some of the protective factors, they're all the same size rectangle, right? But some of those things may be more important or more robust to us. And the same goes for some of the risk factors. A personal trauma may be something larger to us, something a little bit heavier that we have to bear than other things, right? So, but just thinking about how resilience is this balancing act. It's a constant balancing act. So how do we promote resilience? We need to promote these protective factors, and for that individual level, this can begin with personal attitudes. It's your belief systems. And some of those things can be how connected or committed someone is to school. It can be the connection that a child or adolescent has with a caring adult. In fact, one of the factors that leads to well-being for most adolescents is at least one strong, supportive adult figure in their life, whether that's a parent or a coach or a youth group leader. It doesn't matter, but at least having one is significantly going to help them to have positive outcomes. Having close, supportive friends. Not everyone has supportive friends. We can say we have close friends, and adolescents in particular, they may not make the most appropriate decisions with their friendships, right? We all know the risks of having maybe one friend that doesn't quite follow the rules or tends to engage in risky behaviors more often than other people. So just having close friends or people that you hang out with a lot is not the same thing as having someone that's supportive. Having emotional health and connectedness. So what I mean by this is having that connection to supportive people, especially from the family. If you have supportive, caring parents who are warm and responsive, that will do worlds in building an individual's resilience. But that connectedness really matters. So it just comes down to that, having supportive, positive people in your life. Another factor is empathy and concern for how your actions may impact others. This is not something that is an automatic, right? There are developmental milestones that we have to go through, that we have to learn how other people feel, and then that helps us to develop empathy. It's not an automatic. So this develops over time. But one way we can foster that is to provide those situations where children can engage in what we call pro-social behavior, right? They're paying attention to someone else's feelings. We can point out, hey, look, Susie's crying because you took that truck. You see how she's sad because she wants the truck back? So we're just pointing out for those younger children, right? And that can help develop empathy early. So what about family resilience? It's similar to individual resilience, but it's different because we're viewing the family as a system of working parts. The family is not a whole, and it's not only parts. It's a whole of moving, working parts that all work together. And so we have to kind of view the family as that system when we talk about family resilience. So one of the top things is very, I guess, sort of like well, of course, we need to have resources. Every family needs resources to meet the most basic needs: food, shelter, and access to the monetary needs that they need, right? To have warm clothing or cool clothing when it's hot out. Those different things are basic human needs. And so that's at the top of the list because it's the most obvious, but it's also the most important. If we don't have those basic needs met, we can't move on to more important needs. So social support and social interactions, again, it's the same as with the individuals, right? But with the family, we need this to be interactive, not just with each individual in the family, but as a family interacting with one another. And that makes a big difference. One thing that can really help families is to use what we call a strength-based approach. So instead of looking at what we need, what's missing. We know what's missing, right? But what do they have to offer? And every family has things to offer, but they may not all be able to articulate what they have, right? How many of us, when we're feeling like really defeated, like we made a mistake and we can't overcome that mistake, and then somebody says, well, what's really good about you? Can you come up with a list of 5 things that are good about yourself when you're feeling so low? It's really hard. It's a good thing to do, but it's hard to do that. And it's the same with families. So, but having that strengths perspective can be really important because we can show the families, hey, you do have a lot to offer. You're really supportive of each other. You have a lot of love to give. And some of the things they may not be aware of, and so they might need someone to point out, what those strengths are, but every family has strengths. We can help them to improve their communication through family relationship training, parenting classes, those type of things. And another suggestion might be a family budgeting class. A lot of families don't know how to budget, how to use a budget, what even is a budget. And just being able to manage your money can make a significant impact on how well you do in the future, right? Because then you won't be spending money on things that are unimportant. Or you may realize that you eat out too much or whatever it is. So that can also be an important thing for families to do. So the community. At a community level, we're talking about it's pretty broad, right? We have all of these different groups. We have individuals. We also have families, and we have families of all shapes and sizes and colors and shades. And so we have to address that idea that we have all of these groups of different, they look different, right? But we have the same needs because we're all humans. So thinking about the community, one suggestion is to start with the most at-risk groups. So these are going to be those people that are already seeking welfare, people that are in court-mandated parenting classes. These are people that are already in a pretty not-so-great situation. So we can start there. And one of the reasons you might start there is because you automatically have some kind of a knowledge of what that family lacks. I know I talked about strengths, but it's important to understand what's missing too, right? We don't have to point that out to the families because that could be negative. But we're going to point out to them, hey, we know that you're having these struggles. We understand. Because that shows them that you have empathy for their situation. So starting with those most at-risk people, you can start with an assessment. There are a number of different assessments out there. The ACEs questionnaire that we all took earlier, that can be very useful, especially working with individuals. You could give it to the whole family. There are a number of other questionnaires that are similar that can help us to assess what are the risks, what are the strengths of this family or this individual. Focus on risks that can be changed. So the list of things underneath here are things that have been identified through research to be risk factors for one reason or another, right? So female status, LGBTQ status, racial or ethnic minority. These are things that are part of a person's identity and a person's existence, and they can't be changed. So we can't fix that as a risk factor, but we have to take it into account. So we just yes, okay, I see that I'm working with this mother who is a female, and I know that puts her at risk. Okay, but we don't stay there. We go to the strengths. So what are the factors of resilience I keep talking about, that we have to build these factors of resilience, right? One of them is called self-compassion. Self-compassion is similar to mindfulness, and it's been used in therapy and in intervention, prevention programs for a number of years. But the basic idea of self-compassion is, how do you treat a good friend? What would you say to a good friend who calls you with a big problem and they're sad or they're concerned? Do you say, well, that's really stupid that you're worried about that. I think you should just give up. We don't say that to a good friend, but sometimes we say that to ourselves. And that's very unkind. So the idea behind self-compassion is to change that inner voice and to say, no, I can't treat myself that way because that's not how I would treat a good friend in trouble. So see, these are some of the questions that are on the survey. You can find this for free. Just search self-compassion scale on Google. You can find it. You can find it on there. So I try to be understanding and patient towards those aspects of my personality I don't like. When I'm going through a very hard time, I give myself the caring and tenderness I need. When I feel inadequate in some way, I try to remind myself that feelings of inadequacy are shared by most people. And there are a number of other questions that are very similar to this, but you can see that this is trying to get you to reflect on how you think about yourself, how you treat yourself, and how you think about your own struggles. This bottom one is really important when we're talking about building resilience, because what we're talking about is taking our experiences and whatever struggles we're having and putting it into perspective of the human condition, right? Everybody goes through hard times. Almost everybody failed a test in college. Almost everybody has had some kind of car trouble, flat tire, fender bender, different things like that, right? So we have some common humanity amongst us. We know this. And that is, it's important to raise our awareness to that common humanity. I like literature. And so I'm providing a quote from Hamlet. But so here's Hamlet. In Hamlet, Shakespeare wrote, "There is nothing either good or bad, but thinking makes it so." And this is the idea that we sort of, through the way we think, we create what we feel is happening to us, right? We create in our minds how severe a problem is, or how much it's going to ruin our day or our life or whatever. It's how we think about that and how we define that problem. Are you guys familiar with Thomas Edison? Okay, Thomas Edison has famously said, "I have not failed, I just found 10,000 ways that won't work." He's the inventor of the light bulb. He's the reason that we can see inside right now without having to burn flames and things, right? So Thomas Edison understood this power of how we think about things. He framed his failures in a positive way. So it's not, I didn't fail, I just found all these things that don't work. It's just part of the experiment. It's just part of this process of inventing. He also said, "Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time." This is a sentiment that is found in multiple cultures. There's an old proverb, Chinese proverb that says, "Fall down 7 times, get up 8," right? So these are things that it's just a way that we need to think about what's happening to us. Has anybody heard of growth mindset? Oh, good, a few. Growth mindset is a way of thinking. This idea was come up with by a woman named Carol Dweck, and she sort of realized that when children fail at something, particularly in school, when they don't do well, if they have this idea, "Oh, this is too hard," then they're less likely to keep trying. They want to give up because it's too hard. And so she came up with this idea, and if you look on Pinterest or Google, there are literally thousands of ideas how to teach this to children. And so this is just one. Change the way that you talk to yourself. Instead of saying, "I'm not good at this," try thinking, "What am I missing?" Instead of thinking, "This is too hard," think, "This may take some time and effort." Instead of thinking, "I just can't do math," try thinking, "I'm going to train my brain in math." So this is just a way of reframing those problems into a way that we can actually solve them. And this is taught to children, but it works for adults too. So growth mindset. Developing a growth mindset is the simple act of changing and reframing what you think so that it becomes something positive and something that you can learn and grow from. I like this little graphic, so I'm going to read the little things to you. So resilience begins when you've been knocked around. You can either say, "Phew, I'm never doing that again." Or you can take a minute to regroup and say, "Let's try that again now that I know myself better." Struggling through rejection, heartache, or loss is inevitable. Resilience is about the choices you make afterward. Learning more about yourself, proactively finding things to be grateful for, drawing your own silver lining. Once you've developed resilience, you'll be amazed at your strength. Any Vincent van Gogh fans out there? Okay. Vincent van Gogh was an impressionist painter. That's one of his paintings there. He had no professional training. In fact, he had professional training in another career, but he really wanted to be an artist. And he tried and failed and tried and failed and tried and failed so many times. But he is rumored to have said this, okay? I'm always doing what I cannot do yet in order to learn how to do it. So this concept of yet is part of building that growth mindset. The power of yet is that you can add it to the end of almost any self-defeating sentence and change its meaning. So you can say, I just don't get it yet. Okay? It turns it into something that's actionable, that's powerful. I don't understand yet. I say this to my kids all the time and they get really annoyed with me. Okay? But this is true. Anything that you can't do right now, that's not a life sentence of you can't do it. It's a you might need more time. You might need to dedicate a little bit more effort to that task. But you can do it if you want to. You keep trying. So that's the power of yet. Okay. So now I'm going to play a storybook for you. I hope you enjoy it.
Gerald was a tall giraffe whose neck was long and slim. But his knees were awfully crooked and his legs were rather thin. He was very good at standing still and munching shoots off trees. But when he tried to run around, he buckled at the knees. Now, every year in Africa, they hold the jungle dance, where every single animal turns up to skip and prance. And this year, when the day arrived, poor Gerald felt so sad. Because when it came to dancing, he was really very bad. The warthogs started waltzing, and the rhinos rock and rolled. The lions danced a tango that was elegant and bold. The chimps all did a cha-cha with a very Latin feel. And 8 baboons then teamed up for a splendid Scottish reel. Gerald swallowed bravely as he walked toward the floor. But the lions saw him coming, and they soon began to roar. Hey, look at clumsy Gerald. The animals all sneered. Giraffes can't dance, you silly fool. Oh, Gerald, you're so weird. Gerald simply froze up. He was rooted to the spot. They're right, he thought. I'm useless. Oh, I feel like such a clot. So he crept off from the dance floor, and he started walking home. He'd never felt so sad before. So sad and so alone. Then he found a little clearing, and he looked up at the sky. The moon can be so "Excuse me," called the cricket, who'd seen Gerald earlier on. "But sometimes, when you're different, you just need a different song. Listen to the swaying grass and listen to the trees. To me, the sweetest music is those branches in the breeze. So imagine that the lovely moon is playing just for you. Everything makes music if you really wanted to." With that, the cricket smiled and picked up his violin. Then Gerald felt his body do the most amazing thing. His hooves had started shuffling, making circles on the ground. His neck was gently swaying and his tail was swishing round. He threw his legs out sideways and he swung them everywhere. Then he did a backward somersault and leapt up in the air. Gerald felt so wonderful, his mouth was open wide. "I am dancing? Yes, I'm dancing. I am dancing," Gerald cried. Then, one by one, each animal who'd been there at the dance arrived while Gerald boogied on and watched him quite in trance. They shouted, "It's a miracle! We must be in a dream! Gerald's the best dancer that we've ever seen! How did you learn to dance like that? Please, Gerald, tell us how." But Gerald simply twirled around and finished with a bow. Then he raised his head and looked up at the moon and stars above. "We all can dance," he said, "when we find music that we love."
Everybody likes story time, right? So why did I make you watch a children's book, right? This children's story is about a giraffe that has a problem. And his problem is people don't think he can dance, and he doesn't think he can dance either. Until someone supportive comes to him and says, "Hey, maybe you just need a different song to dance to." And that can be what we are. We're that little cricket voice saying, "Hey, maybe you just need a different song." Which is why I was hoping that you would get that connection right, so Gerald. Okay, so how can we foster this resilience, right? Individual resilience is achieved through protection factors that are within the individual. This is things like perseverance, diligence, positive coping skills, a positive mindset, that growth mindset I was talking about. And it can also be in the environment that the individual is in. So in this environment, things like supportive friends and family are really important. Having access to needed resources, family income, the health care that they need, the mental health services that might be available, and all of those things, okay? For the family, I was turned on to this idea of they call resilience cascades. And another way of looking at that is positive spillover. So when you provide services for families that are intended to address one issue, And then there's like a secondary benefit. So it's unintended positive consequences that was not part of the program's goals. So an example was a program that was designed to help incarcerated parents spend time with their children. And they taught the inmates parenting skills and then set up visits with the children that were supervised so that they could continue to have a positive impact in the child's life and that they could keep having a relationship. So that was the goal of this program. Well, at the jail, they had a space, and at first it was just the, like whatever white linoleum floors and walls and chairs. And the kids would get restless, and then they would start misbehaving. And so the researchers said, okay, well, we need to address this. So they brought in a colorful rug, and they brought in some toys, and left the chairs, And then something happened. As the children waited for their incarcerated parents, they were playing with the toys. And the parents who brought the children in started talking to each other. And they developed this supportive network of people who were just like them, whose kids were in just the same situation. And they started going out for coffee. They started having play groups on the side with all of these kids. They started supporting one another when something difficult happened. And it's all because they set up toys in the room for the kids to play while they waited. So that was an unintended and yet positive consequence of something that they were already doing. So there may be something that you're already doing that can have this spillover effect. And I also want to point out that one of the most important aspects of resilience for individuals and for families is to have repeated success, even if it's something small, right? So a kid that gets 2 math assignments that are graded and they get a B or an A in a row when they were getting C's and D's. Okay, repeated success. Because what that does is it teaches us that, oh yeah, I guess I can succeed at doing this. And that provides some of those foundational beliefs of self and of family that can build this resilience. One of the things that can be addressed is someone's spirituality or the family's spirituality and religious beliefs. It doesn't mean that you have to delve into doctrine or scripture, but just being open to those that you serve, letting that into their own life. You don't have to be part of it, but just you don't shut it down. So if they want to talk about how their church family is helping them, we can support that because it's them getting support from somewhere, right? If they want to talk about how their belief in God or a powerful universe is helping them to deal with this really difficult time, who are we to tell them that they're wrong, right? So just having that open dialogue, allowing that to be there. We can also teach mindfulness techniques. Mindfulness is not just having an empty mind. It's not a clean slate. What it is allowing yourself to be in the precious present moment. And so it's the difference between this adult here, whose mind is very full of to-do lists and shopping and concerns for family, all kinds of things, and the child whose mind is right there in that beautiful park, enjoying the flowers and the sunshine. So mindfulness can be a really important tactic that we can teach, and it can be just as simple as this. It doesn't have to be like a whole slew of mental exercises or breathing exercises, although those can be helpful as well. Okay, so what about the community, right? Because we are all working, trying to make the community a better place. But how can we really do that? So community resilience is defined as the capacity of a given system to implement early, effective adjustment processes to alleviate strain imposed by exposure to stress, and thus efficiently restore homeostatic balance or adaptive functioning. That's a lot of big words, right? So it's okay. So here's what we're talking about, okay? We're talking about capacity. So capacity is like how much you can hold, right? So every community has a certain amount that they can hold. So our capacity of the community is distributed across multiple adaptive interacting systems. It's all of the different agencies. It's part of the state government. It's part of city policies. It's all of these things, right? It's, again, resilience being this dynamic process. And it's varying through all of these systems in the community. Resilience in the face of trauma or disaster is interdependent upon the capacity for resilience. This is developed prior to the event as well as in the face of the event. So think of a natural disaster. What happens during a natural disaster? We all hunker down for safety, and then when the storm passes, we assess things for damage, right? And the first thing we do is assess ourselves and our family, those closest to us. And when we find out that we're safe, that our family is safe, then we check on maybe the neighbors, or maybe you call people from church, or maybe you call any extended family that you have in the area to make sure everyone's okay, right? So we have this sort of like moving out from the center to try and check on people. And then we find out what needs are, and we take action to try and meet those needs. This is what we do in the face of a disaster as individuals and as a community. Okay, so a community's ability to respond to these shocks and stressful events is our capacity. So what resources do we currently have available? And you have to think about not just resources in terms of the economy or in terms of how many beds at the hospital do we have. Those things are important, but it's also important to think about what everyone is doing. People have agencies that are addressing specific needs in the community. And all of those people, all of you, have something to offer to the community resilience, to the community's capacity to deal with these different things that come up. Okay, so the community needs to be robust enough that it can benefit from difficulties, shocks, or stressful events. And that benefit is that in one way or another, we learn something, and then we improve for the next time something happens, right? It builds our awareness of where are the holes, where do we lack? Oh, well, we know that we don't have enough mental health professionals to deal with a crisis situation, or we know that we don't have enough food banks in operation, just as examples. So the community has risks and protective factors as well. So remember my little scale from the beginning? So think about that scale as we look through these. Risks of the community could be poverty, a lack of employment opportunities, a lack of institutional support, like from police or the judicial system, general tolerance of sexual violence or whatever the issue is, general tolerance of racist crime or whatever it is. Okay, you put the issue in that parentheses. And weak community sanctions, meaning the community doesn't have these things in place to keep this event from happening. Protective factors, community support and connectedness, coordination of resources and services among community agencies, access to mental health and substance abuse services. Now, remember how I said that if you have one, that sometimes it's a little bigger, it's a little heavier? So this second one, protective factor, coordination of resources and services among community agencies, that can be so big. It really can, and I'm going to expound a bit on that too. So how can we promote community protective factors? And these are just some ideas, just some, okay? But one of them, it has to do with equitable access, right? Equitable access to schools and transportation, equitable access to services in various languages, equitable access to health insurance and health care, access to educational, economic, and job opportunities. So if we don't have these opportunities available to everyone in the community, what's stopping that from happening? Right? What are those roadblocks that these people are facing? And then, is there something we can do about those roadblocks? Okay, some other protective factors, social support and integration support systems. Okay, that's what kind of like what we are. We're a group, and that we can provide this continual support. Okay? And then even things such as the simple actual environment, right? How many buildings are and sidewalks are wheelchair friendly? Are there bike lanes? And are the bike lanes on the roads safe to travel for both drivers and cyclists? Whatever barriers there might be, how difficult would it be to remove those physical barriers so that everyone can have access? Okay, I think it's important to talk a little bit more. I talked about how resilience is a process, right? So we used to think about resilience or like resiliency as like some people are and some people aren't. You either got it or you don't. And decades of research has said that that's not the case at all. Every person has the capacity for resilience, and every community has that same capacity. So we have to think about resilience in terms of a functional trajectory. It's a moving target, but we have to always be moving toward that target, right? So what was the weight of the stressor? What about the culture? What was the circumstances? What were the individual variations in response to the risk that existed? So if we were to experience multiple road closures, school closures, and then everything like stops for long enough that we don't get enough food in, what's our community response going to be to a situation like that? Okay, and taking that into account when we're talking about building community resilience, it's really important that we recognize that as individuals, we can face the exact same trauma and be impacted by it differently. We're not all the same. We're not. And so because we're not, we're going to have multiple different outcomes. Even people in the same family who went through the exact same events at the same time, they can end up different outcomes, right? And at the same time, we can experience different traumas and end up at the same place. So it's important to recognize that that's a part of this whole building and fostering resilience, is that we have to recognize these individual differences. All right, so protective factors for the individual. I put personality up here, and I put that because I think it's important to remember that certain aspects of our personality are biological. We were born that way. Like our brain is just, is going to be that way. And then our environment also impacts that personality development. But there are parts of us that are just who we are. We were just born with that personality trait. So that's important to recognize. You can't always change some of those things. Your perception, okay? Here's where I'm bringing in that self-compassion and that positive growth mindset again. It's so simple. It really is so simple. It takes a lot of work, though, just to be fair. It takes a lot of work on the part of the individual to really develop and own that self-compassion and that growth mindset. But it can be done. And then coping skills. And these have to be like those positive coping skills, right? It can't be the things that we do to cope with something that then have negative consequences later on, like substance use. We can't do that. It has to be positive coping skills. For the family, social support. This means support within the family and from outside the family. So that may mean that this family needs to learn how to communicate better. And if that's the case, we can fix that, right? We can address that issue. Parental warmth. Again, something that can be addressed. We can look at this. We can say, okay, this parent is really struggling to respond warmly to their children, but it's okay. We have this program, this parenting program, and it helps to develop warm responses in parents. So we can put her in there, and then she's going to learn this skill that's valuable, and that's going to not just impact her, but her children and future generations as well, who are then going to observe and learn this parenting behavior and then be better parents, right? Discipline. Again, back to those parenting skills, right? If we can teach positive discipline, that can have that same multi-generational effect. One of the things that is the most important for particularly adolescents to do well is consistent parental monitoring. This is really hard to do, especially nowadays with social media and whatnot. It makes it harder. But keeping teens from making big mistakes or participating in risk behaviors, it really does start with that parental monitoring. But other adults in that child's life can also help. So that's important to remember too. And then family bonding. So sometimes families just don't know how to be with each other. And when that's the case, they may need some help figuring out how. And that's, again, one of those other things that we can address. Okay. So I got some of this information from the National Preparedness and Response Science Board. They're basically in charge of making plans for big natural disasters or terrorist attacks, what have you. So they have like this whole list of what every community should have and what every family should have in their home to prepare for any kind of emergency situation. But they have some really good points about having a community that's building resilience. So one of those things is strengthen and promote access to public health, healthcare, and social services. Everybody's got to have that access. And so whatever we need to do to improve that is what we need to work on. Is it transportation, because some people live too far out and they can't get there? Is it that the hospital doesn't have the capacity to deal with this many people of the community? What's the problem? And then what can we do about it? Promoting health and wellness alongside disaster preparedness. So we can't just say, okay, here's your emergency bag for 72 hours, pack food, pack outfits, pack whatever. Make sure you have water stored. Those are important things for a natural disaster. But there are other psychological consequences that we have to also address. So being prepared for that as well. So this is where we can come in together. You all are doing wonderful work. But how often do we talk to one another? How often are you collaborating with other agencies to get things done? So what I'm asking is, if we're going to build this community's resilience, we have to be willing to collaborate and communicate effectively. Okay? make sure that whatever programs are available are targeting at-risk people. Because if we can help those at risk, then the entire community benefits, right? And build social connectedness. So how we do that is through some of these collaborative events, through family events in the community. There are a number of different ways that we can enhance this, but we're humans. We need to feel connected. And if we don't feel connected to somebody that cares about us, we're in trouble psychologically. All kinds of consequences can occur, right? So we need to have this situation where we feel like there's someone or somewhere to reach out to in a crisis. As a community, taking an assessment. So if we were to plan a collaborative group and we get a bunch of agency leaders together, kind of like this event, and we get together and we say, okay, what are the risks in our community? And we would make a list of those risks. Okay, and then what are the protective factors that we have? What are the good things that our community has going for it? And then we figure out a way to, at the same time, reduce the risk factors and enhance those protective factors. Because if we do that, then our community can become more resilient, because we'll have more of those resources that we need to address the risk factors that exist. Okay, I have one more video before it's like totally done. This video was put out by George Washington University. They're piloting a program where they're building community resilience through collaborative efforts between researchers and community workers on the ground. So I'll show you a video.
Quite a bit about. In the last 3.5 years, our teams have learned quite a bit about childhood and community adversity. And out of that knowledge have been born a number of innovative changes to address program, practice, and policy change. Here's a look at what they're doing.
I think that this approach inspires people, it brings people together, it engenders collaboration. Those are all essential ingredients to making any progress with any issues in public health, but especially issues like these.
Creating a movement, a cultural shift. So we're recognizing that for a lot of the child care professionals that we work with and for the families, it's really about thinking differently about families. You know, certainly what happened to you versus what is wrong with you. And really trying to spin off of that place where we're naming parents as the problem, but clearly seeing parents as the solution. So we really looked at always connecting the ACE message with hope.
One of the things that we do when we are in 5 cities across the country is that we make sure that we are doing our work highlighting what we can build upon, not just highlighting the inequities, because that is certainly a part of the work, but we want to show the supports and the buffers that are already in place that we can build upon, the great work that is already here in place. We know there is resilience. We need to support that resilience.
The partnerships that we've seen developed benefit both the local communities and the public health system, because they're creating synergies and building on the capital within the collaboration to do good work in the community, improve the resilience as it relates to adverse childhood and adverse community experiences in a way that really speaks to community engagement and increasing overall capital for collective action.
Co-creation allows us as a convening organization to make sure that we're leveraging the thought processes and also best ideas of those organizations that we're partnered with. And then it also allows us that as we create solutions, that we're all a part of the solutions.
Over 70% did not have a comprehensive BCR is helping, first of all, by helping us get to the table. We say they need to hear those voices. Thank you, BCR, for bringing us to the table so that they can hear those voices. And we can, as of now, I would say in this capacity today, we are representing the people, but next time we're here, I think I would dream of us having those individuals, those community voices at the table also.
We moved from thinking about local partnerships and collaborations to address this issue to going to the policy level. And that really is a significant step forward.
A big part of the BCR movement is it now gives us enough critical mass to also bring together a meeting with state leaders from like our Oregon Health Authority, the Department of Human Services, Oregon Youth Authority, all these different agencies to come together to talk about the work that we do collectively.
Dallas is now a citywide initiative, and they didn't start that way. In fact, in Dallas, they started 3 zip codes because that's where Children's Health had the most robust relationships. And then that partnership network grew, and then the city of Dallas took it on, which actually had the capacity to make this a citywide initiative. You know, similar with Oregon, it was actually starting in one school, one public school.
The BCR movement and the pair of ACEs will help us create, I think, a different contextual narrative about the work that we do in the state. And at a policy level, having all those agencies with us in a unified vision, I think, has a lot of potential.
It's really helping to understand how these types of movements begin, and that's what we're really talking about, is a movement for change.
Okay, is that not cool? Right? So if I could have a dream for the future, right? If I could have a dream for the future, it would be researchers like me and like other professors in other colleges in our area working together with community service providers and working with those in the policy area, that we can come together and create a plan of action that can actually really make this community more resilient. So that would be my dream. I want to just thank the Buhl Regional Health Foundation for letting me to come and talk about resilience. I get really passionate about it, so sorry if I droned on too much, but I appreciate this opportunity, and thank you so much.